25th of September, and we've been telling you folks over and over again, you never know what you're going to see on Great Day, correct?
That's right.
So last week with Dr. Eugene Cherny, we had a chance to show everybody our breast implants and how interesting they were and the different materials that were used in this.
Those were cool. Those are very cool. Everybody loves them. It's the #1 operation for women in the United States.
And speaking of that, before we go to the topic on hand, earlier this week, we had a story about a lady who claims she had an additional one added, as you can see in this photo here. Okay, now there was stories coming out that this might not be real. She lost some luggage, and part of her claim form said that inside that luggage was a prosthetic 3-breasted device, and that was part of the package that she was looking for. And then there's some people saying that no surgeon would do this. There's no reason for it. She claims she got somebody to sign a piece of paper. And what is your take? You're the professional. Okay.
I think it would be hard to find someone in the United States of America to do this because it is obviously pretty wild to do. And not everybody remembers, like the Arnold Schwarzenegger movie that had a character with 3 breasts on it back from the 80s.
Right.
But when there's something that you don't want to do in the United States, you can often find some maniac in Mexico. Thailand especially is where they do a lot of crazy stuff, especially the transsexual surgery and stuff. So you can, unfortunately, you can usually find somebody to do something crazy. But that being said, I've thought about the technical aspects of this operation, and it's very hard because if you're an average woman with cleavage, where do you put that implant? You have to move that cleavage to the side. This is actually easier said than done. You would have to get, this operation would be very major and very complex, and it looks a lot better than I would expect.
Okay,
based
so that
on the complexity of it.
This could be fake.
Certainly could be fake. Very easily could be fake.
Okay, so that's the rumor that's floating around right now. But today we're taking it to a different part of the body, right?
We're going to talk about butts today. Anybody want to talk about butts?
Hands going up all over the studio here. And one in particular that comes to mind happens to be Kardashians. And
anybody right now, butts are popular.
Butts are big.
Yeah. What is it? Most women, from what I can remember, were like, how do we make our butts smaller? But now it's like, how do we plump them up?
A long time ago, I liposuctioned many butts to make them smaller, but I haven't done that in quite a while. And today, it is very hard to think of the name Kardashian without thinking about big butt at the same time.
Right. Now,
it just goes together.
Now, she claims, one of the Kardashians claims, I have not had an implant. I have not had a butt implant. That
is probably true. The way we treat small butts today, and a lot of women get really small butts as they get very slim, especially with aging, and it tends to get flat.
Here we go.
So there's a good example. Now, what we do is only if you're really, really skinny and you have no fat to donate to transfer to another place, that's when you get a butt implant. Now here's somebody, she's got a little extras here, so she probably had what Kim had, and that probably means liposuctioning that tummy. Look at all that stuff above the butt. See, that's what makes the butt look big, is the stuff that's above it, not the butt itself. So you liposuction that stuff above it, and it lengthens and deepens your waist. You re-inject it into the butt, and that is a great look. That is a very, very good look.
So butt injections themselves are more popular right now than as far as than a butt implant.
I do way more Brazilian butt lifts, which means liposuctioning the fat and then re-injecting into the butt, and that is a beautiful example because look above. Look how skinny the waist is above.
Oh, wow. Yeah.
See, that's where the fat came from that went into the butt.
That's the same person there?
That's the same person, and so
really,
that is a very synergistic thing. You make the upper above the butt smaller. It always makes the butt look bigger anyway, and then you pump it in for shaping in the butt, and it looks like even better. So that is a beautiful combination.
I never knew that was a result of the slimmer waistline.
That is the best donor site for the fat. So fat injection as a whole is like super popular because we've understood, our researchers in plastic surgery tell us that it's fat shrinkage, especially in the face, that makes us look old. So there's all kinds of guys that are injecting fat into the lips, above the lip, into the cheekbones, all over, to reverse the appearance of aging. So this is like the hot topic. It's really big when you go.
Does it stay there? I feel like it would move.
Well,
You know, it might, you know,
would slide down your leg
well,
or what?
something. You know, I feel like
You have a big club
I
foot in
feel like,
about
you know,
2
I'd be
years?
there, I'd be like, it looks good. And then after a week or a month, it'd be like, oh, there it went. And now it's long.
well, you know, gravity is always our problem. But I would say this, a really good plastic surgeon that really, you know, follows, you know, your continuing education, learns the best way to harvest the fat and to process it so that the fat that you transplant really lives the longest and takes the best.
So the cells will continue, obviously, to live.
They
right?
can transplant very well, and they can live very well in their new location. But you have to, you know, be really up on the science on how to process them and only inject the good stuff.
Is there upkeep afterwards that the patient has to do? Like, do they have to continue to get injections or
Sometimes
exercise the area? Or?
really good fat injections, they'll be pretty stable. But sometimes this is sculpture, and so you might need to inject a little more or liposuction a little bit, depending on how it takes. Little tweaks, and this is not unusual for plastic surgeons to do. But there shouldn't be any actually routine maintenance like that. But what happened to Kim Kardashian might happen, and that's this, that when she was getting close to her wedding, she was like binge eating. She was like really needed comfort food. And so where the fat is injected, that's like where the fat is going to go if you get overweight. So
Why is that the case? Just because it's something new, or?
Well, you have a bunch of fat injected into your butt. You have all these fat cells there, so that's where the fat's going to go. And so Kim Kardashian's butt was literally as big as this table before she went on a crash diet before her wedding. It was like this big.
Are you serious?
Well,
Wow.
I go to the supermarket. I
Apparently
read the
used too much of
tabloids.
Fix-A-Flat. Huh? Okay.
Yeah.
Wow.
Oh, yeah.
Well-
Now that has been done too. That's
Yeah.
a whole other topic. Oh my gosh.
Well, because you see Nicki
Yeah.
Minaj and Iggy Azalea and stars right now, they're not only singing about butts, but you look at them and it's just like they're skinny gals,
Right.
but it's like, wow, you got a lot downstairs.
Well, there's some. I got a buddy. His name is Tito Mendieta. He's a superb plastic surgeon in Miami. He's doing something to the butt every day. Here in Des Moines, it's not as popular, and where it is the most popular, you're going to see we have a large Latin American community here, and they get it done a lot. They get there. You know, there's a Latin American patient in Des Moines getting her butt done every day.
They like the curves.
Yep.
Now, what is that?
It's becoming mainstream, though.
What does
Yeah,
that set
sure.
you back price-wise, in case somebody wants to have some sculpting done?
I think you're going to see price ranges in the range between like $7,000 and $9,000, depending on how many places you have to suck the fat out of first.
Okay, so
It's about the same as a tummy tuck, I would say, and breast implants are $6,000, so it's a little more than breast implants.
wow, okay.
Interesting stuff.
Now, we were originally thinking we were talking about butt implants. Is that still something that happens for people or not so much anymore?
Put in quite a few sets of butt implants this year, and that is ideal for the person who wants something like really big and there's not enough fat to create it, or someone who's just like really skinny and you don't have enough fat to suck from somewhere else to inject. So those go in. You know, there's a crease in between the two cheeks. You make an incision in the crease between the two, and you make a space in the muscle, in the gluteus maximus muscle that holds the implants in place. And it's really nice. An implant is very powerful in the butt, just like it is in the breast. It will lift it and make it round and fill it out really great. Look fantastic in clothes.
No, is that something that goes across the board with men and women?
I've talked to guys about it. Yes, I have.
Okay.
Guys are into it too.
Because they have their jeans that keep falling off, right? Don't have a belt on, they fall right off.
Nobody likes being told they got a flat butt.
All right, so and now price on that compared to the injections.
The butt implant is $9,000, about the same as a tummy tuck.
Okay. All right, perfect. Interesting stuff,
Yeah.
Dr. Cherny. You really bring interesting things to the table. We appreciate you coming in.
Well, I hope I prick you guys up in the
You
morning.
do. After the last two things we talked about, I think you might have the coolest job in the world. I'm just saying.
I do have the coolest job in the world. I love
you
it.
get to create. It's awesome. Yeah, okay, when people want to stop by and talk to you, how do they find you?
I'm out on Hickman Road next to Living History Farms. Give us a jingle or please find us on heartlandps.com. We're going to be having a seminar coming up the second Tuesday of October, and everybody's welcome. We will have refreshments, we'll have wine, and some nice hors d'oeuvres to have.
Perfect.
And I'll meet with all you guys.
Good job again, my friend. Good to
My
see you.
pleasure. Great to
All right,
see
buddy,
you.
Take it easy.
Delightful.
7:41. Stick around. We'll be right back. You are watching Great Day.